Let me get the presentation going. Gosh, it's been a minute since I've done this. All right, so I am Dr. India Johnson, and I am with Rose MedSpa and Wellness. So I've worked in medicine for almost 20 years, and the short story is that I have basically hated these medications that kind of go by the name Ozempic, Wegovy, Mounjaro for the better part of a year now since my patients started taking them. I do anesthesia full time prior to starting the med spa. And I just have always felt like people are not very educated about the medications that they're taking, and there are a lot of risks. And so people come in for surgical needs, and they're just not properly managed because they haven't been prepared because they're taking these medications. So first of all, Ozempic, Wegovy, and Mounjaro are on shortage right now. So when a medication is on shortage, it can be compounded, and the FDA allows that. Now, once the medication no longer has a trademark or a patent on it, then you'll start seeing generics being made. But the only time that a medication can be compounded is when it's on a critical shortage list. So that's why you see it advertised as semaglutide or tirzepatide or a medication like that. So you'll see people calling them skinny shots. And I want to talk a little bit about how they work. I'll try not to get too much into the science of it, but I think it's important to understand how they work. So basically, whenever you eat food, it sends a signal to your small intestine, and it secretes something called GLP-1. So that promotes the release of insulin, and it lowers a hormone called glucagon, and it decreases your appetite, and it slows down gastric emptying. So essentially, these medications are trying to mimic something that happens naturally in your body, and then that allows the pancreas to increase your insulin secretion and decrease the glucagon. With these medications, it either hits one of the hormones or both of them. So one of them is called GLP-1, the other is called GIP. And when you're looking at semaglutides, they just work on the GLP-1. When you're looking at something like Mounjaro or tirzepatide, it works on GLP-1 as well as GIP. So you can see that it works in a lot of different places in the body, like the pancreas, obviously, because we know that this was originally a diabetic drug and the pancreas is involved with that. It's involved in the stomach and gut. It can be involved in the central nervous system with regard to your demand or like how much you want to eat. So it's going to decrease your caloric intake. It can, so the GLP doesn't have a huge effect on the adipose tissue, but GIP does. So you'll see later that some of the studies show that the tirzepatide or the Mounjaro can have a greater effect on patients, and this may be why. Kidneys kind of transient. So it works in a lot of different places in the body. Why do we care about the science behind this? Well, basically, in civilized nations, especially America, 70% of Americans are overweight. So that would be a BMI above 25. Obesity would be over 30. So they started looking at studies years ago to look at semaglutide, this natural hormone that would stimulate the GLP or GIP receptors. How can we make people feel full and kind of trick the body into eating less food and kind of stimulating some of these natural processes? So in 2016, this study was published in the New England Journal of Medicine, and it looked at cardiovascular effects for the safety of semaglutides. And they actually found that there was a significant reduction in the risk of cardiovascular events, including death, non-fatal MIs, so heart attacks, non-fatal strokes, in those who took semaglutide. But a lot of times what I hear from patients is, well, I know it was a diabetic drug, but what about people who aren't diabetic? So they did a study called the SELECT trial in 2021. This was also published in the New England Journal of Medicine, and it looked at the cardiovascular effects of semaglutide in overweight individuals or obese individuals, and how did that affect their cardiovascular disease or risk. And they also found that in this population who isn't diabetic, that they had substantial weight loss and a decreased risk of major adverse cardiac effects. So additionally, in 2018, Marks and Libby looked at overall what's going on with this GLP-1 receptor, because they really thought that it would decrease the expression of genes that were associated with inflammation on the whole. So in medicine, we know that basically the root of all disease is inflammation. And so when they looked at this, they said, independent of cholesterol levels, or at least partially independent of changes in body weight, it still decreased inflammation. So I think that this is going to be a major area of research in the future for people with all sorts of inflammatory conditions. So what about the two drugs? So we know that tirzepatide hits two receptors, semaglutide hits one. So this study compared 3 different doses of semaglutide to 1 dose of the tirzepatide, and they found that they all decreased the mean body mass, so weight, and they all decreased the A1C, but they found that the 1 milligram dose of the tirzepatide was superior. So people lost between 4 pounds and 12 pounds in the study period. So who would be a candidate for this? So anybody who's overweight, which includes 70% of Americans over the age of 20. Those who are diabetic, obviously it was initially a diabetic drug. If you have a history of thyroid disease like thyroid cancer in your family, you would not be a candidate. And then also if you have a pancreatic insufficiency, that would rule you out for this medication. But let's talk about real everyday risks. So what sort of things do people see when they take this? It interferes with your GI system, so you can understand how you might see nausea, vomiting, diarrhea. It decreases your desire to eat. When people take these medications, they do not want to eat. So sometimes what you'll see is that patients get dehydrated because they're not thinking about eating and drinking. A lot of times you sit down to drink a glass of water or beverage while you eat food, and so people aren't eating as much, they're not drinking as much. There are a lot of ways to kind of decrease your risk for this. And so we'll talk about our approach with Rose MedSpa and my practice in particular, because I have hated the way that people are prescribing these medications. And so my solution to this is to be able to do things differently and better and educate people in a better way. So my personal experience outside of the med spa world is that I would see patients coming in for unrelated conditions, but they would get extremely dehydrated because they weren't properly educated. And so they would get some electrolyte imbalances. You can also have, it slows GI motility. So it makes sense that if you have gastric reflux, things are sitting in your stomach longer. Of course, you're going to have an increased susceptibility to having acid reflux. You're slowing your GI tract. You may have some constipation. Also, for me personally, with my specialty in anesthesia, we see patients coming in who've not been properly educated about the fact that it slows your GI motility. So if you're having surgery, the reason that we make you not have anything to eat or drink past midnight is because we don't want you to have a full stomach. Well, patients who are on this medication, they're at an increased risk of having a full stomach. And so if you are currently taking these medications, my public service announcement is that everyone should stop taking these medications for 2 weeks prior to having surgery, because we want to make sure you're safe during surgery. Anytime you are losing a lot of weight, it causes strain on your gallbladder. So that's a concern. You need to be properly followed. You can also have low energy because you may go from consuming 2,000 or 3,000 calories a day to consuming substantially less, which could be good for your overall weight, but your body needs some time to adjust to that. So you're going to have low energy and you risk muscle loss. So how do we negate these risks? Because, we've talked about how this medication has a lot of potential to be a good medication, but there are also risks with it. So the biggest thing that I think that could be better for our population is really proper planning, guidance, ethical prescribing practices. So patients are often getting these online. They're not seeking proper follow-up. They're not followed on a regular basis to make sure that patients are eating what they're supposed to be eating. And so, they either have some sort of complications from lack of follow-up, or they have complications because they didn't understand the risks or maybe how to properly manage the medication with their lifestyle. So we talked about how you need to stop it 2 weeks before you have surgery. We talked about how you can have electrolyte imbalances. So you need to be staying properly hydrated, drinking maybe one electrolyte beverage a day. We need to talk about low fat diet, the types of foods to eat and avoid. And so those are some of the things that we do within our practice to make sure that we're prescribing ethically and to make sure that our patients are really well educated. So our unique approach is that every medication that you ever take, including oxygen, has risks and benefits. So what is ethical about prescribing is that we have to make sure that the risks you're taking are not outweighing the benefits. So you are going to get educated through Rose MedSpa and Wellness. You can get these medications from anyone. You can go online, you can literally see somebody that day, you can get a prescription and start taking it. But you need support and education in order to be successful, because what you don't want to do is take this medication, take it for 3 months, 6 months, a year, and then immediately start gaining that weight back because you did not make sustainable changes to your lifestyle. So I think this has a place in medicine to help you jumpstart your weight loss and to get you headed in the right direction, but it has to be paired with proper planning and education. So that is our goal at Rose MedSpa, is to give you all the tools that you need to be successful with this medication so that you're not taking risks for no reason. The compounding that we kind of talked about in the beginning. So when you get this medication, not all compounding pharmacies are the same. So when you get a drug like Wegovy, that is made under very strict guidance and guidelines, and you're getting that from the same place all the time. And that's part of what you pay for. But with compounding pharmacies, there are very, very safe compounding pharmacies. But the problem comes in that people advertise themselves as something that they're not. And so not all of these places are created equally. And so sometimes the public has a hard time discerning where online is a safe place to obtain medications and